Hi, welcome to my channel, Retired with a Full Heart at Home. I thought I would give this a try as long as I think I have a video that might be helpful to someone, and we'll just see how it goes. I have appreciated so much the videos that other folks have done on pre-retirement, planning for retirement, the retirement experiences, travel, hobbies, finances, health and wellness, you name it. And so I thought maybe it would be fun to contribute and engage with the community and see if I can offer up something too. Anyway, I think I've got a good one for you today. My husband and I have been thinking about for a while catching up on our physicals and wellness, and so we just did the Function Health panel of 100 biomarkers, and I thought you might be interested in that process and how it went, what we learned, and in case you're thinking about doing something similar. So what is Function Health? It's a service that's provided by a group of functional medicine doctors that will order lab tests for you and then interpret the results. And the group is led by Dr. Mark Hyman. You've probably seen him on YouTube or on podcasts. And he advocates for preventative medicine prior to chronic illness, to prevent chronic illness. And so they will order the tests for you at a local Quest Diagnostic Centers. Ours happened to be in the Safeway down the road from our house. And you go in 2 appointments and they draw the blood. And it's not as much blood as donating blood, so don't worry about that. But it is a lot of vials. And so they encourage you to make 2 appointments, do them less than a week apart. And then the lab analyzes the results. And then you download an app from Function Health, and as your results come in, that's the cool part, as your results come in, you see them populated in your app. And they've done a wonderful job of explaining what the biomarker means, what the lab reported range, nominal range is based on the general population, and then what their recommendations are for optimal health. So the lab range is based on a general population that might not be as healthy. And so the functional medicine doctors have, will sometimes change that range for more optimal health. So as your results come in, you can read about them, and then it takes, I think, about 3 weeks for all the results to come in. And then once they do, it'll take about 2 to 3 more weeks for a clinician to actually summarize your report. They'll give you a summary, that pulls it all together and gives you an assessment of your overall health and recommendations. So you'll get dietary and supplement recommendations on what to do to optimize these biomarkers. What do those 100+ tests target? They target autoimmunity, biological age, which is very, very cool, your blood health, including your type. I didn't know my own blood type. I'm 58 years old. How could I not know my own blood type? But I didn't. So there you go. They'll provide information on your electrolytes, things like your calcium, your magnesium, your sodium, your potassium, and some other things. Exposure to heavy metals and toxins, including mercury and lead, female hormone health, heart health, immune regulation, including like your white blood cell count and your C-reactive protein, which is an indicative of total body inflammation, your kidney, liver health, your metabolic health. So they do, not only do they do glucose, but they do insulin as well, which is great, and some other things. Your nutrients. I think they test for something like over 20 or about 20 nutrients, including, vitamin B deficiency, D, calcium, iron, magnesium, omega-3, omega-6 balance, which is fantastic. Your pancreas, stress and aging, so cortisol, how well your adrenal function is, your thyroid, and urine analysis, a number of things with respect to your urine. I thought it would be interesting to compare the Function Health panel to the testing that my primary care provider ordered for me from 2011 to present. And I have not been a good patient. I went for a physical in 2011 and then didn't go back again for 9 years. My next physical was in 2020, and then I waited another 5 years to go back again in 2025. So I am not a good patient, but I will say that I went back and looked at the labs and compared them to what Function Health did, and I thought it was interesting, the difference. So just to go through, I never received from 2011 to present any testing on autoimmunity. I also never received a biological age. That's probably not that surprising. I didn't receive any testing on exposure to environmental toxins or heavy metals. And this one really is interesting because every physician recommends that people eat more fish, but they're not testing for mercury. And I was really curious about my mercury levels because I do eat a lot of fish and I love tuna. So that really surprised me that wouldn't be part of a routine panel of tests. They also never did any female hormone testing. And keep in mind that the period of time when I'm looking at these records, in 2011 I was 45, so it was pre-menopause or pre-perimenopause, and then at age 54 I was perimenopausal and experiencing symptoms, and then at 58 I'm in full-on menopause. So the patient that they had in front of them was a perfect candidate to do female hormonal testing on, but yet that was never offered to me. Now, again, in fairness, not a good patient, and definitely I didn't ask for it. I'm the kind of person who would not walk into a doctor's office and, I think demand certain tests. I probably should have requested testing and didn't, but it was also never offered to me, and I just assumed that if it wasn't, it probably wasn't needed, or maybe I didn't even know it was available. I was never tested for nutrients, and being not a spring chicken, I would think that most people my age would be nutrient deficient in some way or another. My pancreas was never tested, so you don't need a pancreas, right? I was never tested for stress or aging. That doesn't surprise me, but that would have been helpful. It would have been cortisol testing or adrenaline testing. My thyroid was tested, and my urine analysis. I had in that entire time, nobody ever asked for a urine sample or requested a urine analysis. And that a little bit blows my mind too. I did think about that one actually, and I wondered why I wasn't receiving a request for that. And I really should have asked, but I feel funny about asking a doctor, shouldn't you be testing for this? Shouldn't you be testing for that? Again, terrible patient, so maybe if I had gone every year like I was supposed to, then maybe those tests would have been offered to me, but I can say that they never were. So just found that interesting. So one of the comparisons I wanted to make was I wanted to look at what Function Health flagged as out of the normal range or not optimal, and then compare that to my primary care physician's testing to see, if the same issues would have been flagged. And of course, in a number of cases, there were some issues flagged by Function Health that would not have been caught in my primary care physician's testing, either because the testing wasn't done or because the ranges that were deemed acceptable in the primary care orders was not the same as the Function Health. And, I'm not going to go into the details of my testing. You can take a look at that. There's check marks in the areas where there is a discrepancy. And of course, your results will be different. My husband's results will be different. But there was one area where Function Health really flagged some cardiovascular risk and atherosclerosis risk that my primary care physician would not have been able to flag. And I want to talk about that because I think it's something that everyone should know about. So one of the most concerning things was that my primary care physician's lipid panel didn't really uncover some of the cardiovascular risks that Function Health flagged. They did a lipid panel and measured my total LDL cholesterol. And you can see my readings were, in the range of 90 to 120. And so they were always flagged as normal. And that's because the threshold for the primary care labs was 130. So anything below 130 was flagged as normal. Function Health flags above range when you're over 120. And really for optimal, they want it to be no higher than 70. So by their criteria, my LDL cholesterol has been elevated since 2011. And so that did concern me because I am the type of person that if someone had said to me, your LDL cholesterol is high, I would have modified my saturated fat. Maybe I wouldn't have been perfect, but I would have definitely had that on the forefront of my mind and, changed my eating habits a bit. The Function Health panel also included 2 markers that are supposed to be more indicative of the risk of atherosclerosis and cardiovascular disease than even the LDL cholesterol. And that was apolipoprotein B, referred to as ApoB. It's a protein that binds to every one of your LDL molecules. And the LDL molecules carry your cholesterol and your triglycerides throughout the body. And so they can count those proteins that sit on those molecules, and they can give you an accurate count of how many of these LDL molecules you have in circulation. And apparently it's the number of molecules that counts more than the total concentration of cholesterol within the molecules. So my ApoB is high, and so that's a risk of atherosclerosis. In addition to that, I also have an elevated, what they call lipoprotein A, or Lp(a), and that's more genetic. And it has to do with the structure of the LDL molecule being more sticky or whatever, having more ripples. I think they call them crinkles. And so it makes it more likely to adhere to your arterial wall. And so my Lp(a) is elevated. You might remember a story about Bob Harper. You remember him? He was a trainer on Biggest Loser back in the day. Very healthy, very health conscious guy. Famously had a heart attack in the gym and nearly lost his life. And it turned out that he had high Lp(a), which was genetic. So I'm very concerned about this, and I did actually report risk of atherosclerosis and cardiovascular disease in my family history, and I understand that there's probably complex factors at play here, and certainly in 2011, I don't know that ApoB or Lp(a) were understood as well as they are today, but certainly by the time we got to the 2020 testing or the 2025 testing, I would hope that this would become a standard for, reporting cardiovascular risk to patients. Anyway, not to be too negative, because I definitely don't want this to be negative. The good news is I know now. And if you really want to dig into this, Peter Attia does a really great treatment and explanation of the atherosclerotic process and these particles, ApoB, their role in it, ApoB and LP(a). If you want to read about it, there's also lots and lots of YouTube videos on these two particles. So if you don't know your ApoB and your LP(a), you might want to check into that. Okay, as scared as I am of cardiovascular disease, I really think cancer scares me more. And I was terrible, as I said, about going for yearly physicals and therefore keeping up with cancer screening. And so I had no reason to believe that I was experiencing anything with regard to cancer, but I really wanted to know, especially since I had been so derelict in my my screening for cancer. So my husband and I both signed up to do the extra testing for cancer detection, and it is really pricey. It's $899 for each one of us. So, but it's a liquid biopsy and it screens for over 50 different cancers, which is amazing, really. It's a couple of vials of blood, and then they are able to look for DNA markers for cancer for 50 different, and I believe they're able to trace it back to the exact type of cancer. So I've got some of them listed on the slide here, but you can read there, of all the cancer types that it can screen for. And so that's just amazing. You get the earliest possible detection, and how easy is it to give a biopsy via blood sample versus a needle biopsy or something like that. So some of these cancers are silent killers. I mean, they really have no symptoms until it's almost too late. And so as scary as that test was to take and then wait for the results to come back, I'm so relieved to say that both of us are clear for markers for cancer. And it is nice to be able to go into the next phase of our retirement, with kind of a clean bill of health, and we don't have to always worry about what's brewing on the inside that we might not be aware of. And the other type of screening that we did, or testing that we did, was the Alzheimer genotype. So we both wanted to know if we had, so the genome for Alzheimer's is ApoE, not to be confused with ApoB. And there are three different types of ApoE. There's ApoE 2, 3, and 4. And so you get one genotype from your mother and one from your father. And, so you can get a 2, 3, or 4 from each of them. If you get a 4, it's higher risk of early onset Alzheimer's. A 3 is kind of a neutral, it's no average risk, with the general population. But if you have a 2, that's actually protective. There's actually a lower incidence of Alzheimer's with ApoE2 variants. So we both got tested, and fortunately neither one of us has a copy of the ApoE4 genotype. And so we were able to call our kids and tell them that because neither one of us has one, that means they don't either. And that was just such a great gift to give our children, the news that, that we don't have it, but also to tell them that they don't. And that doesn't make us free and clear of the risk of dementia. As there are many forms of dementia, not just Alzheimer's, or at least a couple of other forms of dementia. And there's also lifestyle risks too that can cause dementia. So we're going to have to be mindful of those, but at least that really scary early onset Alzheimer's, at least we don't carry the genotype for that. So that was good peace of mind as well. So my husband and I got our results, and we put together our own plan, which I love because I like to lead my own destiny. and be in charge of my own health. And so we both are putting together a plan of action based on our unique findings. So mine is centered mostly around lowering lipids and saturated fat, and his is more centered around lowering his inflammation markers and his improving his metabolic health. And so that's really cool. We both are working on this together. We kind of find it interesting to do the research, and it's something fun to work on together. And we both feel like we want to gamify this, if that's the right term, like the kids do. We want to make these changes and really work hard at it, and then see where we are in 6 months. Wouldn't it be cool if we both see improved biomarkers from 6 months worth of effort through our diet and exercise? So we're super excited to do that. It's a fun project in retirement. I guess I could say fun. We're trying to view it that way anyway. So I think it's cool that you get the information, you can make your own plan and go forward. And then of course, do follow-ups with real medical doctors, as you need to. I definitely am going to be seeing a cardiologist. So anyways, that's what we're doing with our information. So that's nearly all I have to offer up today in terms of function health. I feel so sorry because I feel like people are just so busy and so distracted that they don't always have time to think about their health. And we have, as human beings, I think, enormous capacity to push through pain, to push through not feeling well, fatigue, and keep going because we have so many demands on us. And if you think about it, with your house, you'd never let if your roof was leaking, you'd be on that because, you know how damaging water is. Or if your car was low on oil, you'd probably rush to a gas station or to get an oil change and put oil in your engine because if you don't, it's going to very shortly grind itself to a pulp. But for whatever reason, as human beings, we don't know what's under the hood, and we don't necessarily, we can really be in denial about how we're feeling. And so the great thing about the Function Health panel is that it puts those numbers right in front of you, and I really believe everybody should know their numbers. And once you see it, you can't really forget it. I have not had a pat of butter since I saw those ApoB and LP(a) numbers, and it makes it easier to have those lifestyle changes when you have a why. And so, my husband's given up Coke because he has a why. And so, anyway, it is very helpful, very motivating to see your numbers. And it was a really painless test, and we had all of our results in 6 weeks. So I tried to schedule a doctor's appointment in January. I'm not going to be seen until April. And I tried to schedule a mammogram in January. I'm not going to get that until May. So in much less time than it took to go through conventional medicine, we got these panels done, and we know so much more than we did I think it was 6 weeks end to end. And so how great is that? I really, when I get ready to do something, I don't want to have to wait. It's like like what Harry said, when you know how you want to spend the rest of your life, you don't want you want it to start now. So, and I'm impatient. Anyways, it satisfied all of that for me, and it was so informative. And so, I recommend that you take a look at the panels that you already have, and if you've got them, the extra cash to do the Function Health, it's a great thing to do. Otherwise, I think there are alternatives that are cheaper to fill in some of those gaps and just do tests that are more targeted towards what you want to know about your body. But the great thing is it puts you in control, puts you in the driver's seat, and you're not like me, relying on your doctor to tell you what you need. You can go and do a really complete panel and then decide what you need. So anyways, best of luck, be well, see you next time.